Hi guys, this is Dr. Ketki. Let's discuss the basic concepts of bonding and adhesion in dentistry. This topic is pretty dry, but I'm going to make it fun and easy for you. So let's get started. All of us have studied arts and crafts in school, right? So we all know what an adhesive or what adhesion is. Basically, an adhesive is a material, frequently a viscous fluid, that joins two substrates together. So a regular glue is an adhesive. It joins two things together and it is able to transfer a load from one surface to the other. Some glues are stronger than others, right? So that's what adhesive strength means. Adhesive strength is the measure of the load bearing capacity of an adhesive joint. There is another term called as adherent. It means the material to which the adhesive is applied. What's interesting is that two solids can adhere to one another with or without the help of a third substance in between them. For example, when we deliver a denture to a patient, how does it stay attached? It's because of the capillary attraction provided by the saliva. Another example of solid adhering to solid in dentistry is the way plaque or calculus adheres to the tooth structures. When we talk about bonding, we will be talking about surface energy too. So let's understand what it means when we say a particular surface has high surface energy. In this image you can see this is a surface atom and this one is an interior atom. There are other atoms around this one, so they are all equally attracted to each other. But this atom on the surface is not equally attracted in all directions. So the energy is greater, means it is ready to attract other atoms. This is called as surface energy. You can also think of this in another way. This atom A has a lot of girls around him, so he doesn't have any energy left to attract other girls. But atom B is free to attract other girls. He is not surrounded by many girls, as you can see. Because he is free, he also has higher energy. So he is free to develop relationships with other girls that are coming near him. In other words, atom B is free to develop bonds with other atoms or molecules that are approaching the surface. So that's what surface energy means. The ability to attract other atoms that are approaching the surface. There is another concept we need to understand. It's called as wetting. Why do we need to know this? Because if there is no wetting, there is no adhesion. To produce adhesion on any targeted surface, the liquid must flow easily over the entire surface and adhere to the solid. This characteristic is known as wetting. This ability to wet the substrate is an important factor for the adhesive bond when the adhesive sets from liquid to solid. A number of factors decide this wetting capacity of an adhesive. For example, the surface has to be clean. If there are any impurities on the surface, it will be difficult for the adhesive to properly wet or properly flow on the surface. Remember that when there are impurities on the surface has lower energy than a clean surface. And when the surface energy is low, it prevents any wetting by the adhesive. Here in this table, you can see the surface energy of Teflon is very low. So it cannot be wet satisfactorily by most dental adhesives. How can we tell if a liquid can wet a solid satisfactorily for bonding? Let's put a drop of water on a glass slide, on an acrylic plate and on a sheet of Teflon. We will be able to see that the water drop on the acrylic plate doesn't spread out as much as the one on the glass slide. And on Teflon it forms a bead, means it beads up. If we draw a tangent to this drop, the tangent line and the solid surface form an angle. This angle defines the shape of the liquid. This is called as the contact angle. You have to consider two forces here. One is the force of cohesion. Cohesion means the forces that are between the molecules of the water drop. That is the forces between atoms that are like each other. And one is the force of adhesion between the molecules of the water drop and the molecules of the substrate, that is the glass slide. So these are the two forces. When the liquid spreads broadly over the solid surface, it results in a smaller contact angle. This means that the force of adhesion between the molecules of the water and the molecules of the glass is more than the cohesive force between the water molecules. So smaller contact angle means more adhesion. And here on the Teflon you can see the water drop is not spreading over the glass slide. Instead it beats up. So it means that the force of adhesion is weaker here. The cohesion force between the water molecules is stronger than the force of adhesion. So you can see that the contact angle is a good indicator of spreadability or wettability of the adhesive. At the contact angle of 0 degree there is complete wetting, and at 180 degrees there is no wetting. So what you need to understand is that the smaller the contact angle between an adhesive and an adherent, the better the ability of the adhesive to flow into and fill in the irregularities within the surface of the adherent. Well, you might think it's a lot of chemistry and physics here, but we need to know these things because in dentistry we bond different kinds of materials to the tooth, and we need to know how they are bonded so that we can develop better versions of them. A dental bonding system performs three important functions. It provides resistance to separation of an adherent substrate, that is the enamel, dentin, metal, composite, ceramic, from a restorative or cementing material. It distributes stress along the bonded interfaces, and it seals the interface via adhesive bonding between dentin and enamel and the bonded material. Because of this, there is increased resistance to microleakage, which decreases the risk for postoperative sensitivity, marginal staining, and secondary caries. Now let's see how a restoration adheres to the tooth structure. The fundamental mechanism of adhesion to tooth structure is a two-part process. First, the hydroxyapatite in the tooth structure is removed to create micropores, and then we fill these micropores with resin monomers and then polymerize them, means we harden them. In this way, resin tags are formed that penetrate and micromechanically interlock with the hard tissue. This is the simplest way to look at dental adhesion. There are many other factors too, like wetting. We talked about this, right? It is the first step in adhesion. Basically, it means how well the adhesive can flow over the surface and penetrate the microscopic irregularities. Wetting is how the adhesive makes contact with the surface, and unless it can form contact with the surface, there will be no adhesion, right? So, no wetting means no adhesion. The wettability of an adhesive can be increased by increasing the surface energy of the substrate, that is dentin or enamel. Remember that higher surface energy means stronger adhesion. A clean micro-roughened surface has a higher surface energy than a tooth surface which is not prepared. Because of the higher surface energy, the organic adhesives are able to wet and flow over the surface easily. There should be no contaminants on the surface when the adhesive is applied. Otherwise, that will result in lowering of the surface energy and it will interfere with adhesion. That's why the acid etching is done. Acid etching removes all the contaminants and creates microporosities. Means it creates a high energy tooth surface. In this way, adhesives readily bond with the tooth. So please remember that once etching is done, the etched surfaces must be kept clean, that is free of contaminants like blood or saliva. Only then a sound mechanical bond will form. So I would like to repeat here that etching raises the surface energy, but as we just discussed, contamination can readily reduce the energy level of the etched surface, and reducing the surface energy in turn makes it more difficult to wet the surface with the bonding resin. For adhesion to occur, the surface energy of the resin has to be less than that of the etched surface. So even momentary contact with saliva or blood can prevent effective resin tag formation and severely reduce the bond strength. If contamination occurs, the contaminant should be removed and the surface should be etched again for 10 seconds. There's one more thing we need to understand. Adhesion to enamel and adhesion to dentin is different. You see, enamel is a highly mineralized tissue. So basically the organic content is less than in the dentin. Dentin contains a substantial proportion of water and organic material, primarily type 1 collagen, and it also contains a dense network of tubules that connect the pulp with the dentin enamel junction. Let's understand enamel etching first. So Bjornokor was the one who first etched the enamel using phosphoric acid. Whenever cavity preparation is carried out with a rotary instrument, a layer of grinding debris is created on the surface of the cavity. This is called as smear layer, and this prevents strong bonding. When we etch the surface with phosphoric acid, it removes the smear layer and about 10 microns of enamel to expose prisms of enamel rods, and this creates a honeycomb-like high energy retentive surface. High surface energy means better wetting of the surface, as we just saw. So the adhesive will readily infiltrate into the micropores and polymerize to form resin tags. What would happen if the smear layer is not removed by acid etching and you place a restorative material directly on the smear layer? The bond strength would totally depend on the cohesive bond strength of the smear layer, which is very less, and this is not sufficient to withstand the mechanical forces exerted on the tooth every day. So there would be leakage of oral fluids within the microscopic space between the prepared teeth and the restorative material, and that is why stronger and longer lasting bonds result if the smear layer is removed, because the resins can then directly bond to the intact hard tissue. So this was enamel etching. Earlier, dentists were a bit reluctant to etch dentin because it was thought that it will damage the pulp. Dentin etching gained acceptance only after Fusayama introduced the total etch concept in 1979. In his technique, both enamel and dentin are etched simultaneously using 37% phosphoric acid. His study revealed that dentin etching increased the retention of the restoration, and also pulp damage did not occur as it was thought previously. Then, a study by Nakabayashi et al. In 1984 revealed that when dentin is etched, acid demineralized collagen fibers are produced and hydrophilic resins can infiltrate this etched surface, and it can form a layer of resin infiltrated dentin with high cohesive strength. Such a hybrid layer structure forms a very strong resin bond. Dentin etching is more technique sensitive because, as we know, dentin is a living tissue with more organic component, that is type 1 collagen. When it is acid etched, hydroxyapatite is almost completely removed from several microns of sound dentin. What this does is it exposes the collagen network of the dentin. This collagen network is suspended in water. So you can see how this is different from enamel etching. Etched enamel has to be completely dry to form strong bonds with the hydrophobic adhesive resins, but dentin has to be moist to form the hybrid layer that we just talked about. The amount of water left in etched dentin is also important. If it is insufficient, the collagen network will collapse and this will produce a relatively impermeable layer, so the resin cannot infiltrate into the dentin and form hybrid layer. If too much water remains, resin infiltration cannot fully replace the water in the collagen network, so later on leakage can occur in these locations. That is why we need a primer. This is an additional step. It maintains a hydrated collagen network while removing excess water. So we have covered the basic concepts of dentin bonding in this video. In the next video, we will talk about the different generations of dentin bonding agents. I hope you found this video helpful, and if you have, do check out the other videos and subscribe to the channel, and I'll see you very soon. Bye.